Greetings to all participants and committees of ITTP 2021. My name is Dewi Nuryana. I am from Knowledge Hub for Reproductive Health Indonesia, Faculty of Public Health, University of Indonesia. And I would like to present our study. The title is The Impact of COVID-19 Pandemic on Antiretroviral or ARV Supply in Health Facilities. This is an online survey in Indonesia. For the introduction, we know that coronavirus disease 2019, or as we know as COVID-19, has been declared as pandemic on 11 March 2020 by the World Health Organization, or WHO. And since then, many regulations have been made to prevent the rapid infections on COVID-19, such as large-scale social restriction, or PSBB, that happened in Indonesia in the end of March or early April. And there's also regulations such as limitation of health services hour, limitation of healthcare visitors, which may disrupt the health services process and supply of medicine. And it also will affect the people living with HIV or PL-HIV, which are vulnerable during COVID-19 pandemic, particularly due to their dependency of ARV medications. And according to the data from UNAIDS, showed that the lockdown and closures imposed to curtail the spread of COVID-19 is greatly impacting the production of ARV medicines, and as such could potentially lead to increase the cost and shortage in the supply of these drugs. Therefore, this study aims to describe the impact of COVID-19 pandemic on ARV supply during the first 6 months of pandemic in health facilities. The results are expected to support the policy and program makers in developing approach to minimize the COVID-19 impact of ARV services. This is the methodology of this study. The design is cross-sectional survey, which the unit analysis is health facilities which provide ARV services before and during COVID-19. And we used a semi-structured online questionnaire via Google Forms. And this study is conducted between August until September 2020. And for the data collection, first we sent a request letter to fill out online questionnaire to health facilities via email, and then the health facilities filled the online questionnaire via Google Forms. And this is the results related to the response rate. So we sent an email to fill out the questionnaire to 66 puskesmas or primary healthcare and 130 hospitals. Then for the response rate is quite low, because from the puskesmas we got only 9 or about 14% puskesmas that filled out the questionnaire, and for the hospital there are 32 hospitals or 25% that filled our questionnaire. For the result, we know the distribution of ARVs users, adequacy of ARV stocks provided to PL-HIV, and the lack of ARV supply by type of health facilities and region. The total sample is 41, and from this table we can see that based on the type of health facility, most of health facilities has now experienced the decrease of ARV users during COVID-19, which shows that for the puskesmas, 56% and hospital is 69% have now experienced the decrease of ARV users. Whereas for the region, we separate Java and outside Java because of the distribution of the sample, is most of them also has now experienced the decrease of ARV users. Then related to the adequacy of ARV stocks provided to PL-HIV, most of the health facilities, whether it's puskesmas or hospital, only provide less than a month ARV stocks to PL-HIV, whereas for Puskesmas is 78% and hospital is 75%. Then for the region, same, most of the health facilities, whether in Java or outside Java, only provide ARV stocks for less than a month to PL-HIV. Then related to the experience of a delay of ARV supply, we can see that in Puskesmas, most of them never had a delay of ARV supply. Then about 44% experienced delay for about less than a month, whereas for the hospital, most of them, or 44%, experienced delay less than a month. Then for the region, Java and outside Java, for the Java, 40% never had or experienced a delay before, but 44% experienced delay less than a month. Whereas for outside Java, we can see that they mostly experience a delay less than a month, and then more than equal to 1 month. For the results in discussion, it's related to the number of ARV users and adequacy of ARV stocks provided to PL-HIV before and during first 6 months of COVID-19 pandemic. We can see that the adequacy of ARV stocks provided to PL-HIV is significantly different before and during COVID-19. Before COVID-19, there are 88% of PL-HIV received the ARV stocks for more than or equal to 1 month, but during COVID-19, the percentage is declined to 76% of PL-HIV received ARV stocks for more than or equal to 1 month. Then related to the number of ARV users before and during COVID-19, there is no significant difference related to it. Then we also ask about the open questions. The first question is related to efforts which made by health facilities to avoid ARV stock out. From the response of health facilities, we can summarize that health facilities, to avoid ARV stock out, they ordered ARV stocks more than the previous period, and then they made a report timely to the district or province health officers and have an intensive coordination with district health officers. And then they also limited multi-month dispensing or AMD or ARV stock to PL-HIV. The second one is related to, it's about efforts which made by health facilities if ARV supply is stocked out. From the answer, we can summarize that if the ARV is stocked out, they first report to district health officers or borrowing from other facilities that still has ARV supplies, or they can substitute the stock out medicine with the similar medicine which are available, and they can refer patient to another facilities which the ARV supply is still available. For the conclusion, during COVID-19 pandemic, health facilities experienced a delay in ARV supply and less adequacy of ARV stock to provide PL-HIV. This may indicate that health facilities experience a disruption in ARV services during pandemic, and then strategic planning and programs that focused on punctuality in distribution and availability of ARV supplies are necessary to ensure the continuation of medication in PL-HIV. This is the end of the presentation. Thank you for your attention.